Happy Sunday, everyone. It's July 14th, 2024. I just want to thank everyone who subscribed, and thank everyone who viewed my video. I didn't expect that many people to watch it, for one, and I didn't honestly expect anyone to subscribe to it. I guess that's just my lack of confidence, maybe. But I just wanted to start off. I'm not going to start off exactly where I left off the last time because I wanted to throw some statistics in here about adenoid cystic carcinoma, particularly the sinonasal variety, um, and the maxillary sinus. So overall, I know I said in the last video that the cancer is extremely rare. Only between 1,200 and 1,500 people in the U.S. are diagnosed with it every year. It equals about 0.3% of all cancers. So unfortunately, the actual funding over the years has toward treatment for this type of cancer has been extremely limited. There is research into it, but the research has also been fairly limited. Um, One of the things I should say too is that chemotherapy is the cancer is not receptive to chemotherapy. Some people do opt in and are given the option to give it chemotherapy, and I think they have some new kind of explorative type of chemotherapies that might have some minor implications, but it still doesn't show a whole lot of progress in actually killing off the cancer. So an early stage, which I should also start out by saying it's also very rare for this type of cancer to be caught in an early stage, um, just because the symptoms usually don't present themselves in a way that people run to the doctor for, or they do, and people think it might just be sinus issues or colds or runny nose, until a lump starts to appear somewhere on the face. Um, or some other type of symptom starts to occur. And I previously mentioned some of my particular symptoms that caught my attention, but it took me, oh boy, January, February, March. It took me about 3 months to realize that a lump was actually forming, and I still, I guess just out of denial, didn't necessarily think it was cancer. But so out of the 1,300 or 1,200 to 13 or to 1,500 diagnoses of this cancer type a year, I have the sinonasal type in the maxillary sinus, which there's no actual statistical information on it, but if you look at the amount of people diagnosed with that, it's probably more around the 2 to 500 range. And then I also was diagnosed with stage 4, um, which is not necessarily uncommon, but at that point, they they assess it based on the size of the tumor, based on the maxillary form, and so it's not based on necessary metastasis, even though mine has metastasized to the frontal lobe through a very thin part of the skull, into my orbital bone as well, around my eye, into my right eye, into my cheekbone, and just above the roof of my mouth. So so it's considered a local metastasis. I did want to share that I did start radiation. I've been doing radiation for 2 weeks. I'm unsure at this point how I'm going to progress with the radiation because it's become so debilitating. And it also, unfortunately, fortunately, I should say unfortunately, because I met with a very wonderful, wonderful woman in palliative care, which is the care that they give you while you're receiving treatment. It's pre-hospice treatment. Once the treatment is over, then you're referred to hospice care, and they take care of you until you pass away, um, just through mostly pain management and quality of life comfort. But I wanted to say also that I met with palliative care, and she's been in the field for about 40 years. A wonderful, wonderful woman, very upfront. Um, and also, after meeting with the surgeons, I met with 2 surgeons who had a pretty comprehensive treatment team, um, with multiple doctors. One of the surgeons had been in the field for about 25 years. I know another neurosurgeon who had been in the field for many, many years. And they had made the determination that an actual surgery to attempt to remove the tumor likely would not be able to remove all of the tumor, and it would remove 60% of my face and my right ear. So it would remove my right eye, half my mouth, probably the roof of my mouth, my entire cheekbone on the right side, my entire orbital bone around the right eye, and the health implications for that, and my entire nose, which I can't breathe through already anyway, which makes things very difficult most days, especially sleeping. So the health implications from that would be extremely debilitating. Um, Cosmetic surgery, minor cosmetic surgery might be an option, but it wouldn't be able to restore my face entirely, which I wasn't really concerned about anyway. The vanity piece is completely out the window at this point. I mean, look at me. Um, but I chose obviously not to do that because, well, and most based on their advice, they determined that it really probably was not the best option to take, um, just due to the health implications afterward. You know, the nerve damage, the blood vessels, and all that sort of thing. Um, but I so I did make that decision not to even push to have that surgery based on their advice. Um, because I obviously trusted that they would give me the proper advice. Their team that's been at this for a while. But I also I wanted to say too that with this, there are a couple of people that have commented on maybe not getting the right care, and things probably could have been done a little bit earlier, but unfortunately, this is our healthcare system, and appointments have to be made, and things can't be done on an emergency basis, especially when it comes to cancer before they know exactly what type of cancer it is. So you have to kind of follow procedure. And I was diagnosed with a late stage, high grade form of this cancer, which is extremely rare. This cancer generally comes in as a very low grade, slow growing. People have the surgery. It has a high rate of recurrence, but because it's a slow growing cancer, it's usually considered a chronic condition that people could survive with for many years. The 5-year survival rate for most people at like stage 2 and 3 is about 89%. At the point of 15 years, it's about 30 to 40%. Based on my prognosis, I'm looking at about 30% survival rate at a 5-year point, which I've found out in the last couple of weeks has been reduced. After I met with palliative care and she reviewed my records, she sat with me for an hour to discuss symptoms, and I was informed that even with radiation, which is the only treatment option available for me based on my grade and stage, because it is an 11 or it's a 9 to 11 size centimeter tumor, which is extremely large. So that's 11 or 9 to 11 centimeter length, followed by a 5 by 4 width, which is a large tumor. So to remove it from this area is just not a possibility. But having said that, she gave me with radiation about 4 months to live. Um, with that, um, it's not the easiest thing to take on, but at the same time, it's I'm gonna try to push it as far as I possibly can. And I have a pretty strong will to live most days. I mean, I don't go days without tears, of course, because I think about loss, I think about grief. But I also think about life and the potential of what I have in a very short period of time. I'm extremely grateful. I come from a wonderful family. I have huge support. I have a lot of support with a few people even outside my family, a few friends that have stuck by me no matter what. So, I just wanted to give some statistical information and also give some information on my end of life prognosis. I'll post another video. I'm going to try to post a little more frequently, just on my day to day stuff. You know what I mean? I would like to, show you some of my support, some of the things that I experience every day. And also some of the things I plan to do. I plan on making a trip this coming week to a very spiritual site, to see some people that I haven't seen in a long time. But it brings me a lot of peace. But for today, that is it. I once again really appreciate you guys for subscribing, and I really appreciate you watching. And I just ask that you spread the awareness. And I should mention too, I am 35 years old. So it is young, but I have, for the most part, lived a good life. So thank you, and bless you all.